Welcome everybody to the National League for Nursing podcast. And I'm Dr. Sue Forneris. I'm director of the NLN Center for Innovation and Simulation and Technology. And today we're going to be talking about HoloLens and its use in education. And I have three experts with me today who are going to share their knowledge and expertise in the use of HoloLens. And we'll spend some time informing you, and hopefully you'll find this insightful and spur some thinking on how you can incorporate some technology into your teaching and learning. So I have with me Molly McCarthy, Sean McGovern, and Marion Leary, and I'm going to ask each one of them to introduce themselves. So I'll begin with Molly.
Hi, thank you so much for having us today, Sue. I'm Molly McCarthy, and I'm the National Director for the U.S. Provider Industry and Chief Nursing Officer at Microsoft, where I support business development and strategy for our U.S. provider market.
Thanks, Molly. Nice to have you.
Thank you.
Marion.
Hi, everyone. Thanks for having us. I'm Marion Leary. I am the Director of Innovation at the University of Pennsylvania School of Nursing. And formerly, I was the Director of Research Innovation at the University of Pennsylvania's Center for Resuscitation Science.
Welcome. Thanks, Marion. Sean.
My name is Sean McGovern. I'm a clinical research coordinator at the Center for Resuscitation Science. And in about 2 months, I'll be starting an accelerated nursing program, which I'm really excited about.
So we have a student with us as well. So thanks, Sean.
Students.
Yeah, lots of students. Aren't the two of you, Molly and Marion, you're also in PhD programs?
Yes.
Yes.
Yeah, excellent. Excellent. Well, to begin with, Molly, can you tell us a little bit about HoloLens?
Sure. So the HoloLens, and I know Marion and Sean have one there in their office, so maybe they can pull that out while I'm talking so everyone can see what it looks like. But the HoloLens is essentially a mixed reality smart glass. So think about it as a wearable computer. It's an untethered device that brings in mixed reality, so virtual reality as well as what's going on in your environment. And it really is a tool that's used across industries and had much success within healthcare, really helping clinicians, researchers communicate and collaborate more effectively.
Excellent. And so, Sean, you had a little demonstration of how you wear it and use it. Maybe between you and Marion, can you tell us how you've been using it at your university?
So I created what we call the CPR reality. So we've combined a CPR training feedback mannequin integrated with the Microsoft HoloLens. So as healthcare providers are performing CPR, we have them do that on the CPR feedback mannequin. That CPR quality data is rendered through the Microsoft HoloLens, and a holographic image of the human circulatory system is overlaid back onto the mannequin so that as the healthcare providers are performing CPR, the quality of their CPR dictates the blood flow throughout the circulatory system. So the blood flow increases or decreases to the brain and other vital organs based on the quality of CPR they're performing. The idea here is that if we can show healthcare providers why high quality CPR is so important, they'd be more likely to perform higher quality CPR in the hospital setting. And so we have a randomized control trial going on right now that Sean can tell you about, where we're enrolling healthcare providers.
Yeah, so we're running an RCT, and we're running that at the Penn Simulation Center, which is a centralized center for Penn medicine where doctors, nurses, and respiratory therapists, et cetera, go for a training or retraining in BLS, CPR, or ACLS, and other various courses. So what I do, I have a group of volunteers and research assistants, and we go there and we'll set up the CPR reality system. And we're comparing that to a standardized or the standard high fidelity mannequin, which provides feedback on rate and depth. So they're randomized on the individual level. subjects fill out a brief survey, a de-identified survey about their experience with CPR, cardiac arrest, and then I give them a brief background if they're randomized to the CPR reality. I kind of ask them, have you ever used the HoloLens before? And a lot of people say no, and they're excited to use it. So it's kind of making this trial very easy to kind of enroll because people are excited to use the HoloLens. And so I'll put it on, and I'll give them 30 seconds to kind of orient themselves with the HoloLens and move their hands around and and interact with the environment a bit. But essentially, what they'll do is they'll do 2 minutes of CPR on a mannequin. And there will be a holographic representation of the vascular system, and the perfusion of the vascular system, particularly the heart and brain, is dependent upon their CPR quality. So it's fun to see them, modulate their CPR quality to see poor perfusion or a good perfusion of the heart and brain, and it kind of makes a connection, why we're doing CPR and the importance of CPR, because you can visualize the physiological aspect of cardiopulmonary resuscitation.
Wow.
The other half are randomized to kind of the standard mannequin, and they just perform compressions on a high fidelity mannequin, both of which, regardless of what they're randomized to, they do another 2 minutes on the high fidelity mannequin, and that's to kind of capture their skills without any feedback. So we'll be comparing CPR quality with the HoloLens, with the high fidelity mannequin, to their CPR quality without feedback to see if there's any difference.
Wow, that's really fascinating. What has been the reaction of the participants? Do they easily adapt to the use of the HoloLens, or what has been their reaction?
Yeah, a lot of great comments initially, when people are kind of hesitant to put it on, and especially when I'm setting it up, I'm, doing hand movements, and one thing I always say is, you'll understand this when you put it on, and then they do, and they go through it, and they take it off, and, they say, wow, that was really cool.
Yeah, really interesting.
CPR training's been the same. It's been classroom based and a mannequin for many, many years, and I think this is kind of one of the first changes to that a lot of these subjects have experienced.
Yeah, so. Interesting. Molly, how else is it being used in education?
Yeah, so one thing I want to add just to Sean and Sean, Marian's comments, and just to back up, so if everyone can think of the HoloLens as a mobile device, you've got your phone, you've got different applications on it. It might be the CPR application. They select that one and they're able to complete it. So if you think of it as any other mobile device, so with that comes security, identity, logging in, etc. I didn't say that before, but it's like a wearable computer or a mobile device. I just wanted to clarify that. And we're seeing it adopted in many different areas within healthcare. So one is just holographic surgical planning. Another is in surgery, heads up surgical artificial intelligence bot. A third use case that we've seen is remote surgery or even on-site surgery assist. The fourth one, which we're going to talk more about, is just healthcare training. The fifth is really around contextual patient data visualization, whether that's for the care team, or even I've seen it being used in education for patients, so that if a patient's going in for surgery, they can actually put the device on and understand a little bit better of what's going to happen during that surgery. And then the last one is just cognitive therapy. Okay. And so I wanted to expand a little bit on one use case that I've seen at Case Western Reserve University, and that is we've partnered with them to really transform the way not only medical students are being taught, but also dental and nursing students, and really more of that interprofessional collaborative approach in school, so that when they get out into the real world, they're used to working in teams. And I think that's critical in today's world. So specifically, they've developed an application there where they can actually cut into a virtual 3D human body to understand the intricacies and connections within the body and the different systems. And we have got a great video on that. I'm happy to share that with you guys as well. So
yeah, that would be great if we have a link to that. That would be wonderful.
Sure.
Yeah, thank you. So you're all, experts, in the use of technology in education. Perhaps you can share a little bit of insight into what are some of the trends or gaps you're seeing maybe in nursing education where technology could be more helpful.
Sure. I mean, I can jump in here briefly. I mean, I think we have these technologies now that can heighten realism, heighten stress and fidelity of health and healthcare problems. And we're at a time when we can start integrating those into the classroom. So for the work that I've done, I don't want to just prepare people with the skills to be able to save a life, but I want to emotionally and mentally prepare them to step up and respond when needed. And it's hard to do that sometimes in a classroom setting. You don't get the stress and emotion of some of these high acuity situations that as healthcare providers we often have to respond to. And especially lay providers, we never have to respond to, or very rarely often. And so to be able to integrate virtual reality, augmented reality, and some of these other technologies into a classroom, I think we will be able to better prepare people, not just in healthcare, but in education as well. And so we have an opportunity to start thinking differently about how we're educating the next generation of nurses, of physicians, and others.
Well, one of the things too, when you mentioned some of the high acuity, I know that as we think about the roles of the professional nurses, it's often the low acuity, high frequency situations we want them to be really prepared for, so that we know they can respond to the everyday occurrences and not necessarily just focus always on the high acuity, which in some cases brings some drama and students love that. But the point is that those are probably situations that aren't going to happen as frequently as some of the low acuity. So you're right, to be able to give them that opportunity to experience those things in the classroom as well. It'd be a great way to move that agenda forward. Molly, did you want to add anything to that?
Sure. Yeah, I'll just speak really in general terms. I think that obviously I've been in healthcare for 25 years and within healthcare, 20 years of it within technology. So I've really seen the gamut in the industry and had the opportunity to do some guest lecturing within nursing schools and talk with faculty. And I think in general, one of the gaps I would say is not necessarily the use of a particular technology like the HoloLens or a specific electronic medical record or a specific infusion pump, but really the concepts behind technology, for example, cloud technology and artificial intelligence and all of, big data and what that means, not just for technology in our profession and how we teach, but what that means for the future roles of nursing. Really thinking above and beyond having to have that 1 year of med-surg experience right when you get out of school, which is what, when I graduated, we had to really have. And thinking about, if when care extends beyond the acute care setting, which it does and is, what does that mean for the role of nurses?
Right. It's the use of the information that
Correct.
all of this technology seems to be generating, and how is that informing our next steps in our care of those patients. So yes, very different approach to when we graduated.
Right.
It seems like years ago. So what insights can you share related to the value of the work that you're doing with HoloLens for nursing education as you begin to move this technology into some of the nursing classes. Marion and Sean, do you have any thoughts about that?
Yeah, I mean, I think I'm on both sides of the education spectrum right now. I teach students innovation in health class, and I'm also a PhD student, so I'm taking classes as well. And you know, I think there is a real need and there's a real appetite for thinking innovatively about how we're training nurses and other healthcare providers. I see it all the time with my students, and I experience it with the classes I'm taking. There's something to be said about you know, didactic teaching and reading, but there's a lot that we could be doing to incorporating, like Molly said, not a specific technology, but technology in general into our classrooms. Like I said, for the next generation, for our current generation, but also the next generation of students. I don't know if you have any, you know, Sean's kind of, he's an accelerated student.
Yeah, I think also just thinking about how other industries are using technology to enhance the overall experience and make it more cohesive is another area which we can learn from, and not just looking in healthcare, but really looking outside of healthcare, in retail and manufacturing, even in simple things like banking and how they're using technology. I think that's really important.
Yeah, and those are everyday things that people get used to, and so you sort of expect to see that when you walk into the classroom too.
Right.
It's not so archaic,
Right.
you know, a transition. So what advice do you all have for nurse educators in the context of today's healthcare, and that would help them to embrace this innovation? I think part of it could be generational.
Right.
What thoughts do you have about that?
From my perspective, I think be open-minded. Technology can be somewhat overwhelming, and you know, I think even for me going to work for a technology company, and when we started to talk about cloud technology, I remember the first interview I had to give about cloud technology. It's scary. So I think, you know, it's overwhelming, but it's an opportunity to learn something new, and to think differently about some of the same problems that we've been trying to tackle. And it could be as simple as communication and collaboration.
Yeah, thanks, Molly. Marion.
Yeah, and I would just say take risks. Like, none of us, or not many of us, are taught anything about these technologies. And for me, I just had to go out there and find partners, collaborate, play with it, fail constantly.
Mm-hmm.
You know, technology doesn't always work, and that's okay. And you need to be willing to sort of pivot and learn and enhance what you're doing. And so I would just say, again, just take a risk. And if there's technologies that you're interested in, find people who are working on those technologies and ask them to meet with you over coffee and just play with them and check them out. There's just, the opportunities are endless.
Yeah, thanks. Sean, do you want to add anything?
I think, I mean, I can speak specifically more about the HoloLens. I think when people think about new technology, you know, they're afraid to adapt to new technology. But it's a surprisingly very intuitive device to use. I've worked with a multitude of different backgrounds of technology use, and everyone's been very it's been very adaptable to just about everyone, and it's a surprisingly durable device as well. And then when we think about technology, specifically smaller devices, I think we think they're delicate, but you know, I think it's been in the hands of hundreds of different people, and it's a very intuitive and durable device to use, and a lot of people enjoy the experience.
Great. Well, thank you, all three of you, for joining us today. And we have some links in the text for the blog that you can click onto and learn a little bit more about HoloLens. And thank you to our viewers for taking time to listen in about HoloLens. Have a good day, everybody.
Thank you.
Thank you.